The core problem we have identified is the increasing rate of obesity and type 2 diabetes.
The problem that we've identified deals with number 3 of the UN Sustainable Goals, good health and well-being. We have chosen this because our solution aims to address this goal by using tech to keep health records and helps customers maintain their health, whilst we also strategically partner with health organizations. In regards to our problem tree, the 3 causes which we have identified are inadequate knowledge, healthy food costs, and laziness. Inadequate knowledge is due to ignorance and a lack of education. Healthy food is extremely expensive compared to unhealthy junk food, such as McDonald's. Laziness is due to a lack of motivation, all of which we address with our product. Our 3 symptoms which we have identified are deaths, type 2 diabetes, and the cost to governments. 2.8 million deaths per year are due to obesity. 90% of people who are obese are diagnosed with type 2 diabetes. This ultimately leads to major costs for governments. For example, New Zealand, where the government spends between $722 and $849 million a year. The width of our core problem is spread across 2.3 billion people, as 2 in 7 are obese. The depth of our problem is that 2.8 million people die annually from obesity. To put this into perspective, that is half of New Zealand dead. Isn't that insane? The KPI we have chosen was to improve customer satisfaction. Customers will be able to rate the application. This will aid us in collecting valuable information, which will allow us to analyze whether our customers feel that our app has helped them improve their health.
Check Me, the future of checking sugar levels.
Our app collects the data of every glucose reading, which will be taken from our glucose meter that connects to the internet. The information is stored and kept track of. You are able to share this information with your medical professional. You and your medical professional will get notifications if your glucose readings show that you are at risk. This will help to avoid complications if the patient does not realize that their glucose levels are too high or too low. The app will analyze the data shared from the glucose meter and will notify you of what you need to eat or what exercise you need to do to improve your current state. Your medical professional will also be able to share a weekly plan with the customer to help them reduce their weight and keep in good health to reduce the negative effects that obesity has. Media is available on the app to combat the lack of knowledge about the effects that obesity can have on your health. Affiliations with health food companies and stores means that there is healthy food available to customers at a cheaper price. There is also an option to scan the barcode of their food packaging, allowing you to save the ingredients and nutrition information, which gives you easy access in the future, and allows you to compare the nutrition information against the nutrition plan that you should be following on the app. Our app addresses the underlying cause of laziness by having a point system and leaderboard. Points are collected when the patient loses weight and follows their exercise and meal plans. The app makes the process easier as it allows patients to collect their glucose levels. They are able to then keep track of their own records, therefore streamlining the process. Currently, the only existing solutions are separated systems. We have created a collaborative system which connects the agents and their information respectively.